and a very warm welcome to all of you joining us from around the world. My name is Shahrzad Kiavash. I am a sepsis survivor, a Paralympian, and an international public speaker based in Sweden. And I am truly honored to moderate the opening session of the 5th World Sepsis Congress. Just a few words about me. Sepsis changed the course of my life. As someone who has lived through its impact firsthand, losing both of my lower legs, but not my spirit, I now dedicate much of my work to amplifying voices around health, equity, and resilience. I also serve on the board of the Swedish Sepsis Trust, where I work to raise awareness and drive change nationally. On behalf of the Global Sepsis Alliance, it is our great pleasure to welcome you to this fully virtual Congress. Over the next 2 days, we'll dive into the latest research and innovation in sepsis, from early diagnosis to personalized care to long-term outcomes and broader global health challenges like AMR, COVID-19, and climate change. In this opening session, though, we'll hear from world leaders, experts, including voices from the WHO, Ministries of Health, Parliament, and global research institutions, who will help us frame the path forward. We encourage you who have joined us to participate actively throughout the session. You can see the chat and you can engage with fellow attendees via the chat. And if you have any questions for any of our speakers, simply type it into the chat box. And please, so I can sort out the questions from the actual comments, begin your message with a capital Q and a colon. So that is a Q like question and a colon. So as I said, so I can find it. I will also want to give a heartfelt thank you to our sponsors, bioMérieux, 144 Pharmaceuticals, Adromed, Thermo Fisher Scientific, and Sanofi for supporting this critical global conversation. So let's begin. It is now my great pleasure to introduce Professor Tedros Kissoon, President of the Global Sepsis Alliance and one of the influential voices in pediatric and global critical care. Over the course of his career, Professor Kissoon has led major international initiatives to improve outcomes in sepsis, especially for children and underserved populations. He has received numerous global awards for his contributions to medicine and society, and his leadership has shaped much of the progress we see in the world today. Welcome, Professor Kissoon, for the official opening remarks.
Thank you very much, Shahrzad, and it is indeed my pleasure to welcome everyone to this global conference, the 5th World Congress, entitled Research and Innovation. Indeed, as you have heard, sepsis is a very important health issue that needs to be addressed. This conference has approximately 100 speakers. We'll have participants from approximately 180 countries, and it's truly a global effort to address sepsis. Well, why are we here today? The burden of sepsis remains high, and it has affected, I would dare say, every one of us in the world. Truly, we all remember the COVID pandemic over the past few years. These are undoubtedly tough times, but I have no doubt that we are up to the task. Addressing sepsis requires the entire society in which we live. We need, from those in authority, the politicians, we need clinicians involved, we need the lay public, we need patients and families, we need everyone to address sepsis. And indeed, we at the Global Sepsis Alliance have worked very diligently in the last few years and have put forward, in addition to the 2017 resolution, we have put forward our 2030 agenda, which you will hear about during this session. this agenda is congruent with the 2030 Sustainable Developmental Goals and seeks to address all the aspects of the 2017 resolution. Since our last conference 2 years ago, many countries in the world have started to address sepsis by enacting national action plans. These national action plans, even in its early stages, have borne forth fruit, and you will hear some of the successes. Yet there is a lot more that needs to be done. Indeed, we need to continue and not decrease the momentum despite difficulties that may come in our way. Again, I would like to offer my heartfelt thanks to our sponsors, the organizing committee, those my colleagues in the office of the GSA in Berlin, to you, the participants, and to everyone who have been involved in this journey with us over many years. Let us always remember why we are gathered here. We are gathered here to help those who are afflicted by sepsis, our patients and families. And I wish you all a very productive meeting and look forward to our continued engagement in the years to come in supporting the Global Sepsis Alliance, achieving our goal of a world free of sepsis. Thank you very much. Back to you, Shahrzad.
Thank you very much, Professor. That was touching, a world free from sepsis. And thank you everyone who is writing in the chat. I can see you. So nice to see that you are here from all over the world. We will now continue, and we have the honor of hearing a special message from the Director General of the World Health Organization, Dr. Tedros Ghebreyesus. Dr. Tedros has been a tireless advocate for the global health, equity, pandemic preparedness, and stronger health systems. Under his leadership, sepsis has gained a clearer place on the global health agenda. In this video message, Dr. Tedros will share the World Health Organization's commitment to accelerating progress in sepsis research, innovation, and collaboration worldwide. Let's have a listen.
Dr. Mariam, Jashi, Dr. Tex Kissoon, dear colleagues and friends. Sepsis is responsible for many millions of deaths every year and disproportionately affects babies and children in some of the poorest countries and communities. Many of these lives can be saved with interventions that can be implemented effectively anywhere, regardless of income level. Around the world, WHO is working to strengthen national health systems to prevent, diagnose, and manage sepsis. Later this year, we will publish new guidelines on both the prevention and clinical management of sepsis. And WHO's Acute Care Action Network works with over 50 organizations to implement tools shown to prevent up to half of all deaths in acute care, including from sepsis. We're also working to stimulate more research and innovation, which is the focus of this Congress. For example, we have identified priority pathogens for vaccine research, and we are developing a roadmap to accelerate vaccine development for Klebsiella pneumoniae, a leading cause of neonatal sepsis. We thank the Global Sepsis Alliance for your leadership and partnership as we work together to prevent sepsis and the suffering it causes. I thank you.
Thank you, Dr. Tedros, for highlighting the urgent need to elevate sepsis on the global health agenda. The message is clear. We have a long way to go, but the knowledge, innovation, and collaboration that is needed, it's already within reach. It's time to turn awareness into action. Our next speaker brings a crucial perspective to the global sepsis response, that of health policy and political leadership. The Honorable Dr. Frank Anthony is the Minister of Health of Guyana, a practicing physician since 1993, and a long-time advocate for public health, governance, and reform. He currently serves on the executive board of the World Health Organization and holds key positions in several global health bodies. Please welcome Dr. Anthony, sharing the ministerial perspective on the sepsis response.
Thank you very much. Distinguished colleagues, it's a privilege to join you at the 5th World Sepsis Congress to speak on a matter that demands clinical vigilance, political will, policy coordination, and public awareness. Each year, sepsis affects more than 49 million people and leads to over 11 million deaths, many of them preventable. And behind these numbers are stories of lives lost too soon, families that are shattered, and communities that are weakened. As a Minister of Health, I'm acutely aware that sepsis is not just a medical emergency, it's also a health system emergency, and therefore we must treat it as a leadership responsibility. For too long, sepsis has been a silent crisis, lurking in our hospitals and communities, emergency rooms, and often it goes undetected until it's too late. It does not discriminate between newborns or the elderly, or rural population, or people living in urban centers. Rich or poor countries, we're all affected. In fact, it disproportionately affects people who are poor and people with limited access, things like immunization, people without essential medicine or clean water. As a minister and as a policymaker, our responsibility is to ensure that no one dies simply because we fail to act in time. Sepsis prevention begins with the basics, such as safe birth, vaccination, infection control, antimicrobial stewardship. Once we have these elements in place, we can prevent a lot of these cases. These are not just clinical interventions, but public goods that we must embed in our national health strategies. We must also prioritize primary health care and universal health coverage, because a mother who cannot prevent infection at childbirth if she has no clinic in our village, and a child cannot survive pneumonia if antibiotics are out of reach. Prevention of sepsis begins at the community level, and that is why here in Guyana we have invested quite a lot to build our infrastructure, to train our healthcare workers, to make sure that we can detect these things early. We must also strengthen our health system's capacity to detect and respond to sepsis. This includes developing and enforcing national sepsis guidelines. In many countries, we still do not have them. And in many instances, we are not even following those guidelines that are provided by the WHO. Implementing routine sepsis screening in emergency care and wards must be one of the things that we put in place. Ensuring reliable supply of diagnostics, antimicrobials, these are also essential. And of course, training our health workforce to be able to act quickly when they detect these signs of sepsis. Sepsis cannot be treated by chance. It must be systematized in protocols, rapid response capacity, and a culture of urgency. Let us be clear, sepsis management is not a cost. It's an investment in lives saved, hospital beds freed, and economic productivity protected. From a ministerial perspective, the path forward is very clear. We must integrate sepsis care into our national strategies, including maternal and child health, antimicrobial resistance, and patient safety policies. We must strengthen surveillance and data systems to understand our national burden and to guide decision-making. We must engage the public through awareness campaigns because recognizing the signs of sepsis early can make a difference between life and death. We must work across all sectors and with our international partners because we share a common goal, that is to reduce sepsis. I thank you for the opportunity and I look forward to a productive discussion.
Thank you very much for your remarks. Moving on, our next speaker brings both political insight and a deeply personal experience to the sepsis conversation. The Honourable Lord Clegg Mackinlay served as a member of the UK Parliament from 2015 to 2024 and was recently appointed to the House of the Lords. In 2023, he survived a life-threatening sepsis infection that resulted in a quadruple amputation. His experience has brought new urgency and visibility to the issue of sepsis within UK politics. Please welcome Lord Mackinlay speaking to us from the parliamentarian perspective.
Yeah, thank you very much indeed. It's a great honour to have this opportunity to share my experience and my observations of this, a simple disease, frankly, a simple disease that, if recognised early, need not be fatal. Some of the speakers thus far have reflected on the global response to the COVID pandemic. And yet here we are with a disease in, just say from the UK perspective, takes away 48,000 lives a year. That's close to half of the entire death from COVID in the UK. And yet the response in terms of health spending and general spending of the economy during that COVID period dwarfs anything that is spent on this, almost a killer of a similar magnitude. A mere fraction is spent on it. And yet here we are with a disease that can take off the so-called healthy, and I was healthy, and it's left me with prosthetic hands and artificial legs. But I'm the lucky one. I'm the lucky one because I'm here. I'm sure if it had been in a less developed health system, I would have simply died. And that is the experience. And yet the experience that even I had in an advanced medical situation, a country that has advanced medical procedures and availability, too often we hear, even in the UK, almost on a daily basis, of sepsis not being recognised, particularly in children. And you hear, I'm afraid it's a regular story, the parents take their child to hospital, they're sent away, perhaps with just paracetamol or something similar. They take the child back a couple of days later because the child has got worse. They're sent away again without a test for anything, just general vital signs. And then they come back a third time and it's all too late and that child dies. And that's in the UK. What we're looking for with sepsis is not some remarkable treatment to try and solve an unusual cancer. What we're trying to achieve here is early recognition. Early recognition, I think, perhaps happens in the household when that question needs to be asked when your loved one is probably exhibiting signs of illness that have not been seen before, and they themselves are saying they've never felt this ill. They need to ask this simple question: could this be sepsis? Because if you can get yourself to a health location, the treatment being appropriate antimicrobial antibiotics and fluid is simple, it's cheap, it's almost available internationally at within reach of most everybody. Now, my return to Parliament on the 22nd of May with my new arms and legs was internationally covered. And I'm rather pleased that on that day, on Google in the UK, the most searched for phrase was sepsis. And so just in my little way, perhaps people looked up sepsis. They made the connection of perhaps what their loved one is feeling, and they actually did something about it. But there's a lot more I think we need to learn about sepsis. We need to entrench people's recognition of it, perhaps in family and even in some health systems who treat it in a variety of ways and don't always recognize it as well they should. We need a proper diagnostic. Now, that has been the holy grail that we're yet to find. But often just the patient saying they've never felt this ill in their life should be enough to get the alarm signals going. And then appropriate treatment. Now, therein is another issue, is whether our current range of antibiotics are going to be robust enough in the years ahead to solve what might be, in my case, a simple case of pneumonia was the precursor of my immune response. Will we have antibiotics that will actually do the job that they're designed to do? Or will we increasingly fail that project and people will die where they should have lived in maybe 5 to 10 years ago? So that is a key. But also, I think we need to treat people if they survive. I mean, people like myself in the UK, the availability of the appropriate prosthetics is touch and go and varied at best. So if we're going to keep people alive, and hopefully that is the ambition, then I think health systems around the world need to do all they can to then support people through their recovery as well. But yes, mine is a unique story, and I intend to use the voice that I've been given, continuing in the political arena in the United Kingdom as a member of the House of Lords, to make sure that sepsis awareness becomes entrenched, that health systems, advanced ones like the UK, will actually recognise it better, and that we can make sure that this dreadful disease, this simple effect, immune response, again, which there may be something there that we need to look at. Are some people more prone to an immune response than others? And is there some type of magic bullet, as it were, to stop that response getting overwhelming that we see in sepsis? But yes, I'm on a journey of getting better. People say I'm an inspiration. I'm not an inspiration because I'm alive. I was close to death and I'm alive. I almost feel more for those people, thousands and thousands around the world today, who would be given a diagnosis of some terminal illness. They are those who are to be applauded. Mine is just a story of hope, and it's great to be able to pass that across to this global alliance here today. So thank you for the opportunity, and I'm sure I'll be meeting many of you over the years ahead.
Thank you, Lord Mackinlay, for your remarks. Even though you said that you are not, I would like to say that I find you truly inspirational. Thank you for using the tragedy to make something good out of it for those who are still alive. Thank you. Our next speaker brings a unique combination of clinical, political, and technological expertise to the sepsis conversation. Ricardo Baptista Leite is the founder and CEO of Health AI, a global agency dedicated to advancing responsible AI in health. He is also a medical doctor, trained in infectious diseases, and served for over a decade as a member of the Portuguese Parliament, where he was a national spokesperson on health policy. In addition to his leadership in health innovation, he is deeply engaged in international health diplomacy. In this video message that we will see shortly, Ricardo will share his perspective on the potential of AI in global health and how it might shape a smarter, more equitable response to sepsis. Let's listen.
Hello, my name is Ricardo Baptista Leite, and I am the founder and president of the Unite Parliamentarians Network for Global Health, a network of current and former members of parliaments, congresses, and senates from 116 countries around the world. Parliamentarians that are committed to promoting science-based policymaking for the benefit of the health of the citizens that each of them represent. That is why I am deeply grateful and honored to have accepted the invitation from my dear friend Mariam Jashi, not only CEO of GSA, but also a member of the board at Unite, and also of Konrad Reinhart, a true leader also in his own right in the field of sepsis. And we are grateful for accepting this invitation to be part of this very critical discussion. We know that every year sepsis affects 3 million people in the European region alone. the deadly toll is tremendous. 1 in 5 deaths around the world are related to sepsis. And of course, this also has an economic aspect to it when we see that nearly 3% of the costs of health systems around the world are because of and related to sepsis. So from a humanistic perspective, from an economic perspective, from a financial perspective, we just need to deal with sepsis once and for all, especially because we know that most cases of sepsis can be prevented with the right policies, with the right actions. And that's where we believe that as a network of policymakers ourselves at Unite, that political leadership is of critical importance. We need politicians around the world to mobilize resources towards research and development. We need to make sure that the right policies are put in place so that at every level of society and within health systems, that all the measures are taken to avoid sepsis, to prevent sepsis every time that it is possible. I would also like to highlight with my professional role as CEO of Health AI, the global agency for responsible AI in health, that artificial intelligence and technologies in general can also play a very important role when it comes to the discovery of new antibiotics, but also in terms of the management of health systems and the way we provide care to patients and citizens around the world. This technological revolution can play a pivotal role in making sure that we prevent sepsis and are much more effective in treating infections in the future. We know that sepsis and antimicrobial resistance may actually be the basis of the next pandemic. Most scientists tend to agree that that is probably the greatest risks that humanity faces right now. We must learn from the past. We must learn how to prevent instead of simply reacting. And this is a unique opportunity for us to stop sepsis. And by stopping sepsis, we can save lives. And that's why at our network, we always like to say, it's time to unite. In this case, it's time to unite for sepsis. You can count on us as a network of parliamentarians to continue to promote political action, to support GSA in all of your efforts to end sepsis and save lives. Thank you.
Thank you, Ricardo, for those words. It truly is time to unite. Before we move on to the next speaker, I just want to give you a reminder that for these 2 sessions that are remaining from this opening session, you are welcome to answer questions, which I will moderate and ask the speakers. In that case, please, in the chat, because it's fun to see that you're still writing, please type Q and colon so I can sort them out. So moving on to our next speaker, who is someone whose work has fundamentally shaped how the world understands sepsis. Professor Konrad Reinhart is the founding president of the Global Sepsis Alliance and one of the original initiators for World Sepsis Day and the World Sepsis Congress. For decades, he has been a leading voice at the intersection of science, policy, and patient care, advocating not only for better treatment, but for better systems. His research has laid the groundwork for some of the most important insights we have today about sepsis, its management, and its long-term impact. And his persistence has helped transform what was once a silent killer into a recognized global health priority. Today, he joins us to reflect on the challenges that remain. Please welcome Professor Reinhart.
Thank you, Shahrzad, for the kind words. But to let you know from the very beginning, I always felt supported by people like you, and especially to those families. And one of them is the Carl Flatley family, who lost his daughter. Another one in the US is a Staunton family. And there are so many families in the meanwhile and survivors, which really make me grateful. And they were the ones who gave me the power to keep going And when we got started, there was nothing at all. When I was a young student, 40 years ago, no data, no guidelines, no funding for research. And even 10 years ago, before we had the adoption of the WHO sepsis resolution, sepsis was not a priority for the WHO. It was there were no information on the Centers for Disease Controls in any country. Sepsis just was mentioned in the Global Burden of Disease report in terms of neonates and maternal sepsis, and there were no guidelines. And now we have data, and they are shocking. If you look at this, you will see that there are countries in sub-Saharan Africa where over 50% of the population dies from sepsis. And even in high-income countries, the incidence is in a range which is unacceptable high. And it was already mentioned that sepsis is preventable and probably also the most preventable cause of death and disability in Europe. And when we founded the European Sepsis Alliance under the patronage of the former Commissioner for Food Safety and Health, Dr. Andriukaitis, we extrapolated, because there were almost no data on country levels, data from Sweden, which we had. And there was already at this time a mortality of 15% and an incidence in the range of 800 per 100,000. And extrapolating this data for the rest of Europe, we ended up with at least 3.4 million cases and at least 680,000 deaths. But you should know that almost many more countries in Europe have mortality rates in the range more around 30%. And we had to learn also, and the pandemic was already mentioned, that it contributes to the burden of sepsis. And luckily, and hardly to understand, that only 1/4 of the sepsis cases that happened during 2020 and 21 were related to viral sepsis. This means 4 times more sepsis cases from other causes still happened and still are happening on a yearly basis independently of pandemics. And there is so this means that we had to learn that what Sir William Osler, one of the leading physicians in the world at his time, mentioned in around 1900, that humanity has but 3 great enemies: fever, famine, and war. And of these, the greatest by far and most terrible is fever, still holds true nowadays. If you look at these figures, and this is in part even still an underestimation, and it's hard to understand how this came. And if you look at this data, and this is data from the US, around the time of Sir William Osler, there were 800 crude deaths from infectious diseases, which dramatically decreased until 1950, only interrupted by the so-called Spanish flu. And we learned there that sepsis is preventable by measures such as vaccination, clean care, early recognition, management as an emergency. And we also learned and know in the meanwhile that also in high-income countries, the quality of healthcare systems and the degree of sepsis awareness saves lives, and that this is highly cost-effective. In Australia, without mentioning the word sepsis, between 2000 and 2012, mortality rate of ICU-treated patients decreased from 35% in the range of 19%. And based on the high-quality healthcare system which exists there and their principle for quality insurance like critical incidents reporting and providing and making mandatory rapid response systems, mortality rates there further decreased in a range of 15%. And it was already mentioned, investing in sepsis awareness and quality of our healthcare systems may really lead to a decrease of sepsis mortality in the range of 10%. And this is highly cost saving. Any dollar invested in this awareness campaign in the state of Victoria resulted in a 6-time return in investment. What we unfortunately, and this I took very personally, because we had over 15 years efforts in Germany by voluntary sepsis and initiated voluntary sepsis quality improvement initiatives. Unfortunately, they failed. We were not able to change anything on the twice as high mortality rate, which in Germany is around 30%, in quality insurance initiatives, but also in prospective randomized trial. So it's hard. And on the other side, we learned that mandated quality improvement efforts are highly effective and resulted overall in the US, but also and primarily in the state of New York, in a dramatic reduction of sepsis-related mortality. And we could also learn, in this case from Sweden, that healthcare systems, which are patient-centered and evidence-based, and they invested in this case, after the adoption of the WHO sepsis resolution, 90 million euros in national patient-centered clinical pathway, which includes sepsis. So sepsis there is one of the 6 priority diseases. And the effect is dramatic, and you have seen this. And this is most recently published data, which explains us why in Northern Europe the quality efforts result in a much higher number of quality improvement initiatives, and also the spending of hospitals, etc., is several times higher than, for example, in Western Europe, which, for example, in Germany, less than 5% of the hospital have specific sepsis initiatives. So this explains that even in high-income areas like Europe, we can make much things more better. And this is most recent data from, again, our colleagues and friends from Sweden, who found again that COVID added about 1/3 to the sepsis incidence. So including COVID, there was a 6.7 hospital incidence of sepsis without 4.7. They confirmed the high incidence of non-COVID sepsis with over 815 per 100,000, and confirmed the low mortality rate. And they also confirmed that, fortunately, in this country, only 2.3% of sepsis cases are related to AMR, and still, because the AMR does not mean that you necessarily need to die, but also the mortality rate, of course, is somewhat higher, but still lower as in some other countries. And we have to realize that currently, it was rightly mentioned, we have to consider AMR, because if this AMR will increase and will end up to have no effective antimicrobials antimicrobials, more people will die from sepsis. But if you look on the fact sheet of the European Union on AMR, where unfortunately the word sepsis is not mentioned, you will find that we have 35,000 deaths every year in Europe, and there are efforts and declarations, etc., etc. But this compares to about 140,000 deaths from AMR, from non-AMR sepsis. And for example, we have 2,500 deaths from AMR in sepsis, but a total of 100,000 deaths from overall sepsis, and the mortality rate is in the range of 30%. And we need to understand, and the US have done until now, to understand, to get our priorities right. And this is data from the CDC, kindly put together by the Staunton and Sepsis Initiative. And if you don't go along with the evidence, and part of the evidence is also the understanding on the effectiveness of vaccination, there will be unnecessary deaths. And this shocking data demonstrate that the mortality rate between Democratic and Republican voters, which was identical until vaccines became available in the US, increased or diverted from minus 0.9% to 7.7% in unfavor of the Republican voters, which tells you how dangerous reluctance and hesitancy for vaccination is. We need to decide between facts and fictions. Until now, still in the US, they have data, and they know that sepsis is the #1 cause of death in the hospitals. They know the costs about it. They know on the number of amputations, and that they know on the long-term consequences, and also that it's a factor for maternal deaths, and that more children die there, even in these high-income countries, than die there from cancer. So we can only hope that the CDC can continue their great work, where they point out that anyone can get an infection, and almost any infection can lead to sepsis, which is not a common knowledge or a household knowledge. And they have 1.7 million and at least 3,500 deaths from sepsis. It's evidence that priorities for national healthcare systems in the future should be based on scientific evidence on the burden of disease in any specific country. Unfortunately, this is not everywhere the case. In our AMR strategy of 80 suggestions and measures, only one is dedicated to sepsis. And this needs to change. And as closure, we need to follow and to close the enormous existing gaps. And to achieve this requires that every nation and also future international bodies like G7, G20, high-level United Nations meeting should follow the example of the 2022 Berlin communique of the G7 health ministers, who mentioned there and that they are dedicated to intensify the efforts to strengthen early detection, diagnosis, and therapy of sepsis, and to ensure the synergy with antimicrobial stewardship and IPC programs. And also, they were committed to boost the implementation of the WHO resolution, improving prevention, diagnosis, and sepsis. And this is the way to go. And this global agenda guides us there. And that's why I'm so happy that I have the privilege to work jointly with Kissoon from the Global Sepsis Alliance, and also my follower as president, and also with Dr. Mariam Jashi, who will elaborate now on the 2030 global agenda, with which we can really make a difference because they guide the according way. Thank you so much for your attention.
Thank you, Professor Reinhart. As we are running a little bit short on time, we will continue. Our final speaker brings a future-focused lens to the global sepsis movement. Dr. Mariam Jashi is a senior leader in global health, sustainable development, and international financing with experience spanning over 2 decades and more than 25 countries. She was appointed as the first CEO of the Global Sepsis Alliance in 2023 and has previously served as a member of parliament in Georgia, Deputy Minister of Health, and a longtime UN advisor and policy strategist. Today, Dr. Jashi joins us to speak about implementing the 2030 Global Agenda for Sepsis and what it will take to move from vision to reality. Please welcome Dr. Jashi.
Thank you, Shahrzad. It's such an honor and privilege to join our distinguished panelists in the opening session. As always, we're grateful to Dr. Tedros for his inspiring video address and for supporting the efforts of the Global Sepsis Alliance. I'm grateful to my dear friend and colleague, Dr. Ricardo Baptista Leite, the president of the United Parliamentarians Network. And we're especially grateful to Minister Anthony and Honorable Mackinlay for joining us online for this session. The opening remarks we heard from the Minister of Health from Guyana and the member of the House of Lords of the UK are exactly the comprehensive vision of policymakers, global health leaders that we need for taking sepsis to the next level and truly making sepsis the next success story in global health. This is our ambition based on the 2030 Global Agenda for Sepsis, the very first global strategy, multi-year strategic vision for sepsis that we developed last year and launched at the German Parliament in collaboration with the Global Health Subcommittee of the German Bundestag and my dear friend and colleague, Professor Andrew Ullmann, who was the founder of the Global Health Subcommittee in the German Parliament. We launched the document in close collaboration with the United Parliamentarians Network, Virchow Foundation, that is a Nobel Prize equivalent in global health, and Sepsis Stiftung. We were honored with the special video address from WHO Director General, Dr. Tedros Ghebreyesus, specifically for the occasion of launching the 2030 Global Agenda. And we look forward to closer collaboration with WHO for scaling up the vision. As I mentioned, the 2030 Global Agenda is the very first multi-year global strategy that was developed with engagement of more than 70 stakeholders from 6 geographic regions. We started the national strategic planning discussions on the margins of the UN General Assembly 2 years ago, followed by the World Health Summit related side event on sepsis and the World Health Assembly parallel event. And our strategic partners, including Virchow Foundation, Medical Women's International Association, Unite, Clinton Health Access Initiative, and Sepsis Stiftung, were also joined by GARP. They were part of these comprehensive multi-stakeholder discussions. Later, we were joined by 36 GSA members and partners that have made technical contribution to the document. And the current document is also available for endorsement for any interested public, private, civil society, or academic institution. And finally, we were grateful for technical inputs received from WHO headquarters in Geneva and the regional offices. Last year, we presented at the World Sepsis Congress the basic framework of the 2030 agenda that was still in a draft version. And today I have the pleasure of presenting some of the highlights of the final document, its official launch, and some of the progress that we have made across the different strategic pillars. The document reaffirms that without reinvigorated sepsis response, we would not be able to achieve 2030 Universal Sustainable Development Goals. It's difficult to understand how we could live in a world where every fifth person dies from sepsis, when almost 50 million children, women, and men are affected by this medical emergency, and we don't speak about sepsis in every single political or global health forum. 20 million children under the age of 5 are affected, and sepsis leads to almost 3 million deaths among under 5 children. 5.7 million pregnant women affected every year, and sepsis is still responsible for more than 10% of maternal deaths worldwide. And contrary to the common understanding that sepsis is always originating from infectious diseases or communicable diseases, more than 50 million people suffering from non-communicable diseases and injuries are affected by sepsis, leading to more than 5 million sepsis-related deaths from the secondary complications of NCDs and injuries. And sepsis response is also essential not only for health-related sustainable development goals, but 8 other SDGs, as poverty and malnutrition directly correlates with increased incidence and mortality risks from sepsis. Women are affected more than men, 26 million women every year versus 22 million men. Sepsis is directly related with the capacities to deliver quality water and sanitation, infrastructure, and hygiene practices, especially in health facilities in low and middle income countries that are affected by the most and bear more than 80% of the global sepsis burden. Low and middle income countries should be the focus of our future attention, though even in high income countries, we see, unfortunately, inadequate capacities of prevention, early detection, and early and effective treatment of sepsis. Climate change, it has the potential of exacerbating 58% of the known 375 human pathogens, and with the increased risk of every single infectious disease outbreak, we face the increased risks of sepsis. So sepsis agenda should be also central for the climate change and mitigation strategies. Sepsis in armed conflicts, 120 armed conflicts around the world, and 362 million, primarily women and children in humanitarian crisis, are all at increased risk of sepsis. With the 2030 global agenda, we were able not only to consolidate the latest evidence, but to consolidate and map the sepsis response and success stories. To summarize that as of today, only 15 countries, less than 10% of the UN member states, have national action plans or national policies for sepsis. Most of those countries are high income, and 6 countries, including Australia, Belgium, Ireland, Sweden, UK, and USA, have been also shared as the success stories to learn from, even if we heard from Honorable Mackinlay that even UK faces a lot of challenges with sepsis. Still, United Kingdom is considered to be one of the best performing countries in terms of awareness raising and national protocols and guidelines for sepsis clinical pathways and bundles. We also have 6 additional countries who have made substantial efforts in awareness raising campaigns and capacity building. And in most of these countries, sepsis survivors and families affected by this devastating medical emergency were the driving forces behind the historic changes. Unfortunately, we see very few countries where policymakers were the initiators of the global or the national advocacy efforts and strategic planning. The document also summarizes the economic case for sepsis. And as of today, the average cost of sepsis medical treatment, direct medical cost per sepsis, accounts to €36,000. And those resources represent only 20 to 30% of the overall societal costs. 70 to 80% of the societal burden of sepsis are related to lost productivity due to premature disability, death, or morbidity. And almost half of the sepsis patients, after 1 year of hospital treatment, remain unemployed, first time after their illness. So it also bears a huge societal and economic cost to our societies. And as Professor Konrad Reinhart mentioned, we have wonderful cases from Australia, Canada, British Columbia, very much with the engagement of Professor Kissoon, United States, New York State, with engagement of our dear friends and colleagues from the Rory Staunton Foundation. And we also have case from Vietnam that sepsis drives 47% of septic patients and 56% of families who have lost their loved ones to septic shock into catastrophic, impoverishing expenditures because of unaffordability of this high-cost medical intervention. That is why it's essential that we integrate sepsis into universal health coverage packages. And again, let's learn from Australia and Canada that have demonstrated substantial return on investments, in addition to the most important impact of saving thousands of lives. The 2030 Global Agenda for Sepsis, based on the evidence, lessons learned, success stories, and remaining barriers, is structured around 5 strategic pillars. The first pillar is about political leadership and multilateral collaboration. We need to mainstream sepsis in global health architecture. We have to speak about sepsis at G7, G20, UN General Assemblies, World Health Assemblies, Davos Economic Forums, national and regional parliaments, and ministerial summits. We have to move from 15 countries to more than 110 countries that will have national action plans for sepsis. And we have to integrate sepsis in universal health coverage packages, maternal, neonatal, and child health policies, AMR, WASH, patient safety, and healthy aging protocols and policies. We need to invest in sepsis response. We have to create fiscal space for sepsis response through domestic budgetary allocations. We have to create official development assistance for sepsis. There is no international funding for sepsis from bi or multilateral donors or from global public-private partnerships such as Gavi or the Global Fund that do support health system strengthening efforts, but have nothing earmarked for the sepsis response. Philanthropies and innovative financing mechanisms should be also explored. We need monitoring and accountability, and we have to start producing annual or biannual global sepsis reports to map and track the progress in the 2030 Global Agenda. Since the launch of the 2030 Agenda under the Strategic Pillar 1, we had a number of official statements on the 2030 Agenda and sepsis at the United Nations high-level meetings, as well as the WHO Executive Board. We just concluded an amazing meeting at the European Parliament, hosted by Vytenis Andriukaitis, with a call to action to stop sepsis as the leading cause of preventable death and disability in Europe. And by September, we hope to establish a high-level political platform on sepsis that will bring together from 10 to 12 members of parliaments, ministers of health, or the heads of states from different countries that will lead mainstreaming of the sepsis agenda in the global health dialogue and architecture. And here are the potential member countries where we already have approached. And we do hope that both Minister Anthony and Craig Mackinlay will honor us in being actively engaged in this platform. The second strategic pillar is about health system readiness for sepsis and sequelae. And as Minister Anthony mentioned, we need evidence-based clinical pathways, bundles, and sepsis care cascades for integrated continuum of care. And we can learn from Australia, Ireland, Sweden, UK, US, and other countries that have already put in place excellent guidance and pathways. We need equipment and supplies for sepsis, starting from microbiology labs to rapid diagnostics, ventilators with oxygen, renal replacement therapies, antibiotics, and intravenous fluids. Medical education and training. Learn from France, who has integrated sepsis in undergraduate curricula, or Uganda, for example, how they employ telemedicine for improving the sepsis management. Postgraduate continuous medical education and digital training are all part of this second strategic pillar. And sepsis care cascades and quality improvement is extremely important, and we can again look into the experience of Australia and Spain. Last year, the Global Sepsis Alliance joined the Acute Care Action Network established by WHO that will be integrating sepsis as one of the important aspects of the ACAN action. And the Global Sepsis Alliance experts were part of the WHO sepsis guidelines, tools, and international consensus processes on clinical management of sepsis in both pediatric and adult populations. Number 3 is sepsis prevention in communities. We have to ensure that our general public and opinion leaders understand how important immunization, wash, and health education is for preventing sepsis. We have to increase sepsis literacy and again follow the UK example that has reached sepsis literacy to over 90% of population. At least 80% of public should understand that sepsis is a medical emergency and we need early identification and immediate care-seeking behavior. Media and opinion leaders, media trainings, media-focused World Sepsis Day events in more than 155 countries is our goal to make sure that sepsis truly becomes a household name and is identified to immediate medical emergency. And patient-for-patient care continuum, our speaker from the House of Lords, he mentioned not about the importance of immediate treatment, but post-sepsis care and rehabilitation that is very much ignored in most of the countries, even in high-income countries. And under this strategic pillar, we are happy that last year, sepsis patients from Europe gathered in Paris and issued the call to action to European leaders that was published in the Lancet journal, calling for attention to sepsis in the region. And very soon in April, we will be launching the Global Sepsis Survivors and Family Committee that will be co-chaired by Mariana Haverkamp from Spain and Duncan Brown, father of Cohen Brown, whom unfortunately we lost in Australia. And again, this is a picture highlighting the importance of joining forces of global health leaders and support we need from global health leaders, especially to the sepsis survivors and their families. And this is a historic photo featuring Shahrzad Kiavash and Krista Breaker together with Dr. Tedros last year at the World Health Assembly. And we also need to engage celebrities and opinion leaders. And this is an excellent example how American actor and filmmaker Bill Pullman is currently working on the AMR and sepsis documentary, and he visited Berlin, and we had an amazing opportunity of working with him to integrate sepsis in as an important aspect of AMR prevention. And we hope that Bill Pullman and his team will be also visiting UK and the Caribbean, as well as African region, to highlight and feature more and more stories about sepsis and AMR. Number 4 is sepsis research and innovations, investing in sepsis science and sepsis knowledge hubs, and investing in sepsis research and development. We need novel vaccines against leading pathogens in sepsis. We need new diagnostics, therapies, both antimicrobial, immunomodulatory, and precision medicine, AI tools for early detection and management, and post-sepsis care and rehabilitation innovations. And that is why we're delighted that in February, the Global Sepsis Alliance and Sepsis Stiftung launched the multi-stakeholder Global Sepsis Innovations Platform. Currently, 36 players have already joined the platform, and we look forward to discussions on unmet needs and sepsis prevention, diagnostics, treatment, and care, as well as developing recommendations and official statements to national and regional regulatory authorities on how to make novelties in sepsis management accessible to those most in need. Finally, sepsis should be integrated in pandemic accord and national pandemic preparedness plans, as 78% of sepsis of COVID patients had viral sepsis in ICUs, and every future pandemic will increase the risk of sepsis. Sepsis should be part of the protocols of humanitarian aid and health protocols for civilians as well as military personnel, as well as climate change mitigation plans. If we are successful in implementing 2030 agenda, every year we can prevent estimated 12 million sepsis cases, and by 2030 we can reduce the annual death toll from sepsis by at least 2 million lives. And this is the roadmap, our common agenda, where we look forward to support from ministers of health, members of parliaments, heads of states, researchers, and sepsis advocates. And let me conclude with the words of WHO Director General that nobody should die from sepsis. And the photos of Elia Epifanio, 14-year-old guy from Switzerland. This is the face of 20 million children we are losing every year. And this should not be happening, neither in Switzerland, nor in any other country. And we recently were contacted by the family of Elia for organizing racing for the Remembrance and Sepsis Awareness in Switzerland. And I would like to conclude my presentation with a picture of this brilliant and very promising boy. Hope that we will have less and less stories that are so painful and after which the life is never the same to the families. Thank you.
Thank you, Dr. Jashi, for the run through the 2030 Global Agenda for Sepsis and that very inspiring and touching call to action. We have a few minutes for questions. I would like to ask Professor Reinhart, if that is okay with you. Professor Reinhart, you've spent decades working to put sepsis on the global agenda. What do you see as the most persistent barriers, and what still surprises and frustrates you most today?
Yeah, so that it's so hard, despite this overwhelming evidence on the number of lives that can be saved with equal, not very costly measures, that policymakers in ministries, in parliaments, are so hard to overcome and to understand this. And I think the only way is that more and more families and survivors really take actions, because to change things in democracies requires to convince the population, because they need to get re-elected. And it would be such an easy case to get behind this goal, because it's so obvious. If we do not do it, so the parties in the extremes will take advantage of this, and this must not happen.
Thank you, Professor Reinhart. I also have a question for Dr. Jashi. First, I wrote the question, do you believe the global sepsis community is moving fast enough? Well, that is evident. We are not. They are not. So my question for you is, what needs to shift politically, financially, or culturally to accelerate the progress?
Thank you, Shahrzad. I think the best answer is what we often speak together with Professor Kissoon and Professor Reinhart. We need to transform sepsis not only from medical perspective, but primarily from political perspective. We need political transformation. We need commitment from national governments and international players. We need both political and financial investments to make sure that sepsis is discussed about. We know how immunization, HIV, malaria, and other global health success stories were developed and nurtured And that is exactly the movement we would like to create and we hope to create through the 2030 Global Agenda and support from global health leaders like Dr. Tedros, Craig Mackinlay, Frank Anthony, and Ricardo Baptista Leite.
Thank you, Dr. Jashi. As we have heard throughout this opening session, progress on sepsis will demand clarity, courage, and above all, a word we've heard many times today, commitment. From research to policy, from survivors to ministers, from innovation to implementation. This is a shared responsibility because nobody should die from sepsis. I am truly honored to have been entrusted with opening this Congress, and I want to thank the Global Sepsis Alliance for the opportunity to be a part of this important moment. I encourage you to visit our website, www.worldsepsisday.org, and sign the World Sepsis Declaration. You can also follow us on social media platforms, Facebook, X, Instagram, LinkedIn, and TikTok. A heartfelt thank you to our sponsors and all of the speakers in this session. The conversations ahead will take us deeper into the science, the systems, and the stories that shape the global sepsis response. Thank you for joining us. And now we move forward together.